Okay, we're going to go ahead and do the knowledge check. We'll start off with our questions. In the first minute after birth, you should A, bathe the baby, B, help the baby breathe, C, feed the baby, or D, do not touch the baby.
Help the baby breathe.
All right, good deal. To prepare for a birth, you identify a helper and review the emergency plan. Ask everyone but the mother to leave the area. Prepare equipment only when you need it, or you do not need a helper.
A.
Yep. All right. Prepare to prepare the area for delivery. You A, open all the doors and windows to get fresh air. B, a clean space for the baby will not be required. C, make sure the area is clean, warm, and well lighted. Or D, keep the room temperature cold.
C.
There you go. Which baby can receive routine care after birth? A, a baby who's not breathing. B, a baby who is gasping. C, a baby who is crying and or breathing well. Or D, a baby that is limp.
C.
Yep. Routine care for a healthy baby at birth includes A, drying, removing the wet cloth, and bathing the baby. B, drying, removing the wet cloth, and positioning the baby skin to skin. C, bathing and putting clean clothes on the baby. D, drying and wrapping the baby in the wet cloth.
B.
Yep. When should the umbilical cord be clamped or tied and cut during routine care? A, after the placenta is delivered. B, around 1 to 3 minutes after birth. C, immediately after the baby is born. D, before the baby has cried.
Between the 1 and 3 minutes, whichever one letter that was.
Right. All right. A baby is quiet, limp, and not breathing. What should you do? Let's see. Choices are A, dry the baby thoroughly. B, shake the baby. C, throw cold water on the face. D, hold the baby upside down.
I forgot what letter it was.
Yeah, okay.
Dry the baby.
Yeah. A baby is born through meconium stem amniotic fluid. Which statement is true? Stimulate the baby and clear the airway. Meconium cannot be held into the lungs. C, clear the airway before drying the baby. D, all babies born through meconium stem amniotic fluid can receive routine care.
C.
Yep. And let's see. What should you do in the golden minute? A, bathe the baby. B, deliver the placenta. C, evaluate the heart rate. D, help the baby breathe if necessary.
Help baby breathe if necessary.
Yep, okay. A newborn baby is quiet, limp, and not crying. The baby does not respond to steps to stimulate breathing. What should you do next? A, slap the baby's back. B, hold the baby upside down. C, squeeze the baby's ribs. Or D, begin ventilation.
Begin ventilation.
Yep. Which of the following statements about ventilation with the bag and mask is true? A, the mask should cover the eyes. B, air should escape between the mask and the face. C, squeeze the bag to produce gentle movement of the chest. D, squeeze the bag to give 80 to 100 breaths per minute.
Squeeze the mask so that movements in the chest.
Yep, C. Okay, which of the following signs must be monitored in a baby during the first few hours after birth? A, length. B, breathing. C, smile. D, urine output.
Breathing.
Yep. Baby's chest is not moving with bag and mask ventilation. What should you do? A, stop ventilation. B, reapply the mask to get a better seal. C, slap the baby's back. D, give medicine to the baby.
B.
Yep, you can stop ventilation if A, baby is blue and limp. B, baby's heart rate is 80 per minute. C, baby's heart rate is 120 per minute and the chest is not moving. D, baby's heart rate is 120 per minute and the baby is breathing and or crying.
D.
Yep. What should you do to keep the baby warm? A, open all the windows to allow warm air to circulate. B, give the baby a bath after birth. C, place hot water bottles next to the baby's skin. D, place the baby skin to skin with the mother.
D.
Yep. What should you do to keep the baby clean? A, wash your hands before touching the baby and help mother wash her hands before breastfeeding. B, reuse the suction device before cleaning. C, keep the umbilical cord tightly covered. D, do not touch the baby.
A.
Yep. A newborn baby's heart rate should be faster than your heart rate or slower than your heart rate.
Faster.
Yep. Okay, that's the end of our knowledge check. We will go ahead and move on to how to disinfect and clean the equipment.